Good afternoon, everybody. This is Dr. Jeff Culbert from Schooley's Mountain Chiropractic Center. Did you know that a really common question is, Dr. Jeff, how often can I safely get adjusted? And the answer to that is, as often as you need to get adjusted, okay? Now, I can't tell you without an exam and knowing what's going on in your particular situation, but I can tell you a story about a patient of mine who I happen to be adjusting from 1996 through 2014. And this was a gentleman who happens to be a world-famous improvisational jazz classic concert pianist. Okay, so for 3 years, from 99 to 2001, and then from 2009 to the end of 2013, beginning of 2014, I adjusted him. And for a while, he would come into the office and get adjusted. And then, as fate would have it, okay, between chronic fatigue and a whole bunch of other stuff going on with him, he could not make it into the office. So at that stage of the game, I ran my practice and then I would go out and adjust him. And I would adjust him at lunchtime typically, as well as in the evening. You might ask, why does somebody need to get adjusted that intently? Well, the gentleman had severe arthritis and disc degeneration, big arthritic spurs, nerve openings or nerve foramen, okay, where the nerve passes out of the spine, severely stenotic, okay, so narrowed down. So his neurologist told him that, if you were not getting adjusted as regularly as you were, okay, because they ran a nerve conduction velocity to see what the impulses were like and were there anything being delayed, he goes, your career would be over. Now, does everybody on the planet need to get adjusted twice a day, 3 times a day, 4 times a day? And when he would go out and do concerts, there would be times I would be adjusting him 5 or 6 times a day. When he woke up in the morning, at lunchtime, just before we got onto the plane to go wherever the concert was going to be, after a sound check, after intermission, after the concert was over, after we got off of the plane. Now the question is, why did he require that amount of care, and how did we deliver that care so that it wouldn't be overstretching to muscles and to the ligaments and creating more instability in the long run? All depends on, are you a Ford or are you a Ferrari? Now most of us go around each day basically functioning as Fords. We're workhorses. We've got jobs to do, we've got families to raise, houses to take care of, and we are the reliable, tried and true. We just get the job done. But there's other people out there that are more like Ferraris, and that's not to be degrading to what anybody does, but this gentleman, as a concert pianist, world famous concert pianist, his body needed to run like a Ferrari. If you ever heard him play, okay, and how fast he could play, and the range of which he could play, okay, he is not your average person. I could not play the piano like that. There's no way in God's green earth I would ever be able to do what he does. Okay, but he has a specialized skill, and with the degeneration and the arthritis that was there in his spine, he could not take an aggressive adjustment. We used basically the activator methods on him, a small handheld instrument that gives a very direct and metered force that is as specific as it can possibly be. The other benefit to utilizing the activator technique is it is a technique whose language in terms of attracting doctors to it to know whether it's a technique they want to use, is this is a technique that teaches you where to adjust and when to adjust, but more importantly, when not to adjust. So there's a sequence of going through different isolation tests with activator that lets us know this particular spinal segment or this particular joint is subluxated and needs to be adjusted, or at the moment it is doing what it should be doing and it is currently fine. So the question of how often should I get adjusted and how often during the course of a week or a couple of weeks or a month should you be adjusted really depends on what is the lifestyle that you have adopted, how do you manage stress, what are the requirements or the skills that are needed that need to be maintained to do what you do. And that's going to vary from individual to individual depending on what you do for a living, how well you are supporting your life and your lifestyle with diet, exercise, sleep, posture, attitude, nutrition, and how often you are currently getting adjusted. Because chiropractic is more of a lifestyle than it is necessarily a treatment for any particular condition. Once the condition goes away, it doesn't necessarily mean that your need for chiropractic care goes away. It often depends on how well you can hold your adjustment from visit to visit. There are some people who can hold their adjustment for weeks and sometimes months in this crazy world that we live in. And there's other people who cannot hold their adjustment more than 2 days or 3 days. And in this particular jazz musician's life, based on the stress he was under to perform at that level, the intensity with which he would even just practice his trade at the piano, okay, and how he would contort and move his body while he was playing in the zone. If you remember Michael Jordan, okay, this guy would get into the zone and he would put and contort his body in crazy, crazy positions. So because of what he did and the intensity of what he did, he was functioning as a Ferrari. That every time you take the Ferrari out, you've got to go back and tune it up, okay? Whereas a Ford, you got 15 or 20,000 miles that you can go between tune-ups and regular oil changes with little checkups in between. So it really depends on what is your lifestyle and what are the things that you're doing to mandate the need or the necessity to have an adjustment at that frequency. And a really great chiropractor will tell you, okay, it's never about the pain, it's about the function of the body. There are plenty of people out there who are walking around with diseases that absolutely have no pain, but they are not healthy, and they may not even be fit, because there is a true difference between being fit, being able to do an activity, and being healthy, where all tissues, organs, joints, and glands are functioning perfectly and in harmony with one another. So the next time you're wondering, how often should I be adjusted? If you don't have a chiropractor, you might want to find one. If you're interested in anything that I had to say, please hit like and subscribe, okay? And then that way you'll be privy to our YouTube presentations to give you more information as to whether chiropractic can help you or not. But if you really want to know, then visit our website, smcc4u.com. Visit the patient section and see whatever is on our website if it resonates with you. If you're local to the Hackettstown, Long Valley, Mount Olive area, please feel free to stop in or give us a call and come in for a visit. Sign up for a history and a consultation. There's no charge for that to determine if yours is a chiropractic case. And if you're living somewhere in the 50 United States or even around the world and want to know if there's a chiropractor in your area, we can try to find them. I have resources that definitely in the United States, and Activator Methods definitely has doctors that are around the world that if it's in your area, we can find and make a referral. Glad and happy to do that, because the function and the goal for my office is to literally get my hands on as many people as I can to adjust them and advise them to what is the best alternative healthcare tips or ways of life that you can live to keep you off of drugs and surgery for as long as humanly possible. So this is Dr. Jeff Culbert saying thanks for listening today. It might have been a little bit of a long story about how often should you get adjusted, and is it okay to get adjusted more than one time in a day? Absolutely it is. It depends on what's going on and how that adjustment is being delivered. Jeff Culbert from Schooley's Mountain Chiropractic Center, your leader in alternative healthcare, wishing you a happy and healthy, safe day. Thank you.